So in this presentation, we're going to be going over how to pass the NCLEX and just pretty much breaking it down for you. So whether you are taking your NCLEX RN exam or you're taking the LPN exam, this will be beneficial to either test taker. So I encourage you to take lots of notes, and I won't be able to go back and forth the slides, but try to just take notes as you can and listen as you can. So what we'll be going over, I'll be talking helping you to better understand the diseases. What are some common mistakes most test takers are often making? Something that we see over and over again that causes a lot of test takers not to pass their exam. Also, as well, what is the biggest myth about the exam and why it's not true? And then we're also going to be discussing how I'm going to be showing you how to break down NCLEX questions. So whether you feel like you're a terrible test taker or whatever the case may be, this is literally you're going to understand the best way to approach questions. Okay. So, and I also want to encourage you to stay tuned until the end of this presentation, because those that stay until the very end, you will be able to access and download our free NCLEX prep cheat sheet. All right, so make sure you stay tuned to the end so that you can get access to that. Okay, so now let me just share really briefly a little bit about myself in case you don't know who I am, or to help you better understand how we help you. So my name is Nurse Choma, and I am a registered nurse. I had a difficult journey becoming a nurse, like many people. I did have to apply to nursing school 3 times before I got accepted. I failed med surge, just like many people have in the past have shared with me how challenging it is. Med surge is a very hard class, so I had to retake the semester. Luckily, it didn't affect me being in the program, but I had to retake it. Then after that, after I retook the class, honestly, it changed everything for me and it helped me to better understand the content way better. And so then after that, all the other classes after that was just way easier. And so I was able to finish nursing school, graduate, pass the NCLEX on the first time, and then I got my first job. First job was very, very hard. I was forced to resign my first nursing job, which happened to be a med surg oncology floor. It was known to be one of the most difficult nursing floors in the hospital. And most, like 50% of the nurses quit anyways, but it was very hard for me to do. Then after that, I was able to leave that job because I had to resign. And then I got another job. I gained experience at this new job, which was also med surg, but now it was med surg tele. The last one was med surg oncology. So med surg tele, 4 to 5 patient ratio, still very hard, night shift, but I got better. And then I transferred to a different hospital with better pay. I got promoted. I was offered leadership positions. I precepted, and then I started choosing nursing. So I'm the founder of Choosing Nursing, or choosenursing.net. And so our goal is to pretty much help you to succeed in your path of becoming a registered nurse or post nursing as well, passing your boards in your career, and etc. And so now, because I didn't quit, because I kept trying, we've been able to help over 1,000, and it's probably even more than that, more than 1,000 plus nurses to finally pass their NCLEX exams, and 50% of them are repeat test takers. So a lot of the people that come into our ecosystem have taken the test on multiple occasions, and now finally are discovering who we are. We've also been featured on blacknews.com, Your Black World, African Cable Network, everynurse.org, and many others. And then also I've been a speaker on different platforms as well. So here is the main problem, right? This is the main problem that we've discovered happens for a lot of students that may be struggling to take the exam. And irregardless if you are in the United States, Canada, or if you're in Nigeria, China, Philippines, wherever you may be, you eventually, if your goal is to be a nurse in the United States or Canada, you have to pass the NCLEX exam at some point, you know? So, irregardless of where you're at, one of the biggest problems we notice is that a lot of students are just simply not learning things in the correct order. Okay? That's probably one of the biggest things. You're just not learning things in the right order. So, what does that look like? That looks like you are studying the wrong information, or you're studying information like you're focusing on questions first without learning the content, like you're not really building your foundation. You've been out of school for months, years, weeks, and so your main thing is just has been practice questions, question banks, but you still have not spent a good enough time with the foundation. And that's really the thing, honestly, that's going to cement everything, and that's what's going to influence your retention skills. So doing what practice questions do is that it does help with your critical thinking skills, because it makes you feel like you're, doing something, but then it weakens, or it doesn't do anything for your retention skills, your ability to retain the content. So for example, if let's say you wanted to buy a house, right? So I'm going to give you a different example that everybody can understand. If you wanted to buy a house, or you wanted to build a house, you wouldn't start from the top and then work your way down, right? You wouldn't first build the roof and then work on the bedrooms. Of course not, right? That would be absurd, and that would be very hard to build a house that way. Instead, you would have to work on the foundation and then build the house, right? You otherwise things would just fall apart. The same thing applies to the NCLEX. You have to create a foundation, and then you got to work your way up, right? And so just like with the NCLEX, what's supposed to ideally happen, if you just graduated from nursing school, then nursing school should have provided the foundation, right? Nursing school, if you just graduated within the past, let's say 2 to 3 months or less, then nursing school should have provided that foundation. And then doing questions is just reinforcing the foundation you already have. And then you take the NCLEX and pass it. But the issue for a lot of people is that the reason why they can't pass is nursing school didn't create that foundation. They actually didn't go through a good nursing program, or they cheated their way through nursing school. That happens often, unfortunately. Or they've been out of nursing school for months, some even years. So that's why they have to rebuild that foundation all over again. And it can take it at the beginning, it can take a lot of energy to build that foundation up again. But once you do, and you implement the right strategies, you'll learn it faster, quicker, easier. So let's do a question to give you an example. On the screen, we have a question that says, a patient is brought to the ER by family members. The patient states that yesterday evening she was having tingling and numbness in the toes of both her feet. Today, she now is complaining of bilateral muscle weakness in her legs. Which of the following pieces of information, if found in the patient's history, are most relevant to her condition? Is it one, I have a history of hypertension and diabetes? Two, I exercise once per week on average. Three, we are preparing for a trip to Thailand. Or four, my mother died suddenly in the operating room. All right, so go ahead and read this for a minute and then post your answer, and then we're going to go through it together. Okay. All right. I know this question is pretty difficult, and so it sometimes it takes people a little bit more time to get through it. So we'll go through it step by step. So all right. So looking at the choices, we have the choices now. Let's break down the question. Right. Let's break it down. So once again, you have a patient came to the ER with their family. Patient states they're having tingling numbness in their feet. Now it's the following day. She has bilateral muscle weaknesses. So now the question wants to see if you can identify one. Pretty much you have to honestly be able to immediately recognize what's the main problem, right? So you have to take everything it told you, and then you need to be able to identify what's the main problem, like what is the underlying condition that the patient likely has, and then pick the answer choice that best matches that, right? And so it has to be relevant to all of the information, not just pieces of it. So the first thought process is to look at it and think this is a priority question, right? But there's more to the question than what meets the eye. So what you have to do if you look at this, so one of the strategies that I teach students is to try to narrow down the choices based on the body system that's being affected. All right, I'll say that one more time. Try to narrow down the choices based on the body system that is being affected. Okay, so this is something that is easy to do if you understand each of the systems. Like if you understand cardiac system, neural system, respiratory system, etc., and you understand what are the signs and symptoms associated with each system, then it becomes simpler. So if I was to look at this, I would be thinking this system that's being involved is likely the nervous system or the immune system, right? Because it says that the patient is complaining of tingling and numbness, right? Tingling and numbness, and then bilateral muscle weakness. So any type of problem that involves patients complaining of numbness in any of their extremities, that affects the nervous system, right? Because for every muscle in the body, there's a nerve attached to it. So that influences the patient's symptoms. So I'm thinking either the nervous system, I'm thinking it may be the immune system, like which is also known as the lymphatic system as well. Those are the body systems that's kind of coming to mind based on what is describing the patient as happening. Then I'm going to look at the choices, and I'm going to have to narrow it down based on that information. So based on me guessing, so this is how you do an educated guess without not necessarily knowing what the answer is, or what the what the answer is, I should say. So if you look at the option number one, I have a history of hypertension and diabetes. Hypertension and diabetes, which body system are those two associated with? Hypertension is associated with the cardiovascular system. Diabetes is associated with the endocrine system. So just by based on this strategy, I would throw out number one, because it's not consistent with the system I think this patient is being affected with. Number two says I exercise once per week on average. That system that's being affected is the cardiac system, right? The cardio system. And then number three says we are preparing for a trip to Thailand. On first glance, that could seem like, oh, okay, why is that important? Who cares about them going to Thailand? But you have to look at everything from a medical point of view. And because it's Thailand, so that means they're going somewhere international, right? They're leaving the country to go to another country. So what do people normally have to do before they go to another country? They need to identify whatever their medical needs are, figure out what type of potential diseases are in that country, and protect themselves before they get there. So they're going to have to get immunizations. And immunizations involves the immune system. Okay? So now I would just be guessing number 3 just because it's the same system that I create an educated guess based on the symptoms that the patient is having. Does that make sense? So I would be thinking 3 just as an educated guess based on that psychology. Number 4 says, my mother died suddenly in the operating room. So if a lot of times if patients die suddenly in the operating room, they probably most likely died from cardiac arrest. And so that involves the cardiac system. So that right there, I would just be choosing 3 based on the educated guess, the strategy that we implemented. So now let's see what the true answer is and the true rationale. So the answer is C, or number 3, right? So here's the medical rationale why it's 3. Preparing for a trip to Thailand means that the patient is receiving immunizations. In some rare cases, there are some immunizations that can trigger a patient to develop Guillain-Barré syndrome. And Guillain-Barré syndrome is actually what the condition is that the patient is describing in the question. Okay, see how we got to that? So them having the numbness and tingling in the toes, and then the rapid and immediate change of bilateral muscle weakness is consistent with Guillain-Barré, not consistent with like diabetes, right? Because people think, oh, diabetes because neuropathy and the numbness of the feet, but it mentions tingling and numbness, and it says that they now have bilateral muscle weakness. That's not normal for diabetes at all. Okay, so that's how we got to that answer. So you see how that's one strategy when used in many situations could really help you to break down the choices effectively and answer the questions effectively. All right, so one of the mistakes that a lot of students make too when they're preparing for their exam is that they're not aware of something called pathophysiology. All right, pathophysiology. Do you know what that is? So if you just for somebody that's a fresh graduate would be aware of pathophysiology, because many times a lot of students in most nursing programs they have them take it within the first couple of years of the program. Okay, so but if you've been on nursing school for more than a year, you probably forgot this, and if you didn't get exposed to this in nursing school, then you don't know what I'm talking about. So why is it important? Knowing pathophysiology is what helps you to immediately understand what the question is asking you. All right, I'm gonna say it one more time. Knowing the pathophysiology is what helps you to immediately understand what the question is asking you. So essentially, it's just how the word sounds, pathophysiology, right? So you're essentially studying how the disease process works or is altered or abnormal, right? So essentially, pathophysiology is the study of the abnormality or the change in the function of the body system based on whatever the disease process is. So really brief, quick example: the way that the body works in a healthy human, a healthy person, is that you have blood flow, right? The way blood flows to the heart, flows to the lungs, right? If you're familiar with how that works normally, there's a normal process of how deoxygenated blood has to pass from the right side of the heart, and then from the right side to the lungs, and then from the lungs to the left side, and then to the rest of the body. But the pathophysiology of a patient, for example, that has a bad heart, let's say they have heart failure, is that that normal blood flow is altered. So somebody that has heart failure, their heart does not pump adequately, and as a result, fluid backs up, and that's why they have difficulty breathing. That's why they're short of breath, that type of stuff. So pathophysiology is just pretty much you describing how is the body altered because of that disease process. So this is the disordered physiological process associated with disease or injury. All right. That's the medical more jargon to say it in. But like I said, it's just pretty much you understanding how is the human anatomy changed because they have that disease. How is the human anatomy changed because they have COPD, because they have heart failure, because they have tetralogy Fallot, and etc. If you can understand pathophysiology of multiple disease processes, it makes it so much easier for you to know who to see first, know what meds they should get. All that stuff becomes so much easier because you understand how the body works. The issue for most students that are repeat test takers that keep failing is that majority of NCLEX prep, I'm supposed to say prep, majority of NCLEX prep review programs do not include pathophysiology teachings. It's instead always assumed, right? Because it's like an extra work, that they have to teach. Most of them, what they teach mainly is just focusing on, the risk factor of the disease. What's the risk factors? What's the signs and symptoms? What medications do you give, and etc. So they don't put a special emphasis on the pathophysiology, even though it's the core part of you really comprehending it, because that's something that's honestly the foundation that you should have gone through in your nursing program, because majority of review programs, their goal is not to teach you everything. Their goal is to focus on very specific things enough so that way you can pass your exam. But if you've been a repeat test taker, or if you struggle to pass your exam, then it's the piece that's going to make it very hard for you if you don't learn it fast, and it will keep you stuck. Another thing you can do is that you need to use visual aids to help you, right? You have to absolutely use visual aids to help you. So here's a photo, speaking of the heart, this is a photo showing different types of heart disease. We have valve disease, we have aneurysm, right? So valve, this is a problem where the valves are stenotic. So you see a valve that's closed normally and a valve that has stenosis. We have thoracic aortic aneurysm, right? So you can see the aneurysm is dilated or enlarged. You have artery disease. You can see there's plaque buildup in the arteries. So if you're looking at this, you're like, then it makes sense. Oh yes, they have plaque in their arteries. Of course they're gonna have a chest pain. Yes, that's why we should give them Lipitor in order to help with that the atherosclerosis in the arteries, right? So the interventions that you do become natural because you understand it also from a visual point of view. You have cardiac arrhythmia, you have heart failure, the heart is just enlarged. You have cardiomyopathy, the myocardium is thickened, and then you have pericarditis, right? The layer right here on the outside is inflamed. So when you put the picture next to the disease process, you're going to find yourself literally like learning the content so much faster. How many of you feel where you are, I can't remember the information. I'll study and like I'll forget everything, or nothing is sticking. So sometimes you just honestly need to add visual aids. It's not usually enough to just be reading. Here's one of our testimonials from, this is Jubilee. So she actually passed. She's one of our early students, adopters. She passed her NCLEX exam, her RN exam after being out of nursing school for more than 8 years. So she took her test. She went to school actually in the Philippines, but she took her test in New York, which is where she was living at that time. Passed it at the time. She's, like I said, she's one of our early students. So when she took her test, she passed it with the 265. So she said, I took my exam March 13th. I was in tears because I reached the full number of questions. I got a lot of static questions. I did my best. I thought for sure I failed, which everybody always thinks, you know. But then the quick result came out and I passed. Thank you so much for your help. Thank you for believing me. I'm 8 years out of school and you were able to help me study and pass my NCLEX exam. So it shows you too, it doesn't really matter. It doesn't always matter how long you've been out of nursing school. It comes down to your level of commitment, motivation, and determination. Another mistake is that you're just not learning variations of the same thing. Okay. So, how many of you, when you took the test, right? Maybe when you took the test, what happened is that um, it's like, oh, I studied this. Like I studied diabetes. I studied, whatever it is. Like you know, you studied it, but the problem though is that you weren't familiar with the terminology that it used. So a lot of times that's another problem too, is that sometimes with a lot of questions, it's really just comes down to you have to be familiar with all of the variations. Okay, all of the variations. So here's an example. We all know what hypertension is. I would expect that you would know what high blood pressure is, right? So you have different types of hypertension. You have primary and you have secondary. Primary is also called essential hypertension. And then secondary hypertension is also called non-essential hypertension. So primary hypertension is the one that most patients have. There's no clear cause, and they develop high blood pressure first. Secondary hypertension is where they develop some type of disease, like kidney disease problem first, and then they get high blood pressure afterwards. That's rare. Usually people get high blood pressure first, and then it leads to other problems. So if you don't know the difference, if you take the test and the test, when you get the question, the NCLEX question, it says your patient has essential hypertension, or it says the patient is experiencing blah blah blah. This is their BP, and you look at all the choices, and the choices says is it A, primary hypertension, B, essential hypertension, C, non-essential hypertension, or D, secondary hypertension. You're gonna look at that and be like, huh? Like if you didn't study it before, if you weren't exposed to it before, you're gonna look at that and be like, what? I don't wait. What does that mean? Right? So that's the problem right there. Is that if you're not familiar with the different variations of the same thing, you're going to be easily thrown off. All right, another tip as well is that you have to also pay attention to increments. Increments. So many disease processes happen in levels and stages. All right, I'll say that one more time. Many disease processes happen in levels and stages. So you have to pay attention to increments. So, for example, going back to high blood pressure, you have normal blood pressure, you have pre-hypertension, which is 120 to 139, systolic, diastolic, we're looking at 80 to 99. You have stage 1, 140 to 159. You have diastolic, 90 to 99. And then you have stage 2, which is greater than 160 for the systolic, or the diastolic is greater than 100. And then finally, you have hypertensive crisis, which is greater than 180. And then the diastolic is greater than 120. So here's a quick critical thinking question. Do you think that as the nurse, do you think that you would treat a patient that has, let's say, stage 1, the same way that you would treat a patient that has hypertensive crisis? No, right? Of course not, right? So somebody that has stage one, they're not going to get the same medical interventions as somebody that has hypertensive crisis. And that right there is one of the many reasons why you have to know the stages and increments, because they're not going to get the same treatment. So therefore you need to have different critical judgment when it comes to the patients. Whether you are RN or LPN, you're going to treat them differently. One of the common myths that people believe about the test, and this is probably something that hinders a lot of students from moving forward, from studying, from trying again, is I need to know everything to pass the NCLEX. Oh, it's just so much information. I don't know where to begin, so I'm not going to try it all. Or I'm so tired, I tried everything, it's not working, right? So the it's not it, now. Don't get me wrong. There is some quite a bit of information you should definitely know because you're going to be working with patients. But it's not really about trying to acquire a lot of information, as it is about you being able to understand the information well. So if you understand the bigger picture of nursing, if you understand core concepts, you understand how the body works in general, that honestly will help to cement everything. So it could be where you could take the NCLEX and maybe some of the stuff you see on the test, like you never saw that drug and you never saw that disease process. But because you're able to, because you have an understanding of the bigger picture, because you understand generally how the body works, you have a strong understanding of what would be the most likely need of the patient based on the diagnosis, or you can use simple keyword clues to help you rationalize to the best answer, or even the strategy I showed you at the beginning of the class, right? If you can do those things, you can honestly pass your exam. So here's an example. This is Corinne. Corinne, same thing was similar with her. She went to nursing school, and then we have a lot of people that's also based in the U.S. as well. But also we also attract a lot of international students too. So she went to nursing school in the Philippines, graduated, but she was literally almost a decade out of nursing school and still couldn't pass her boards. So her goal was to pass the NCLEX so that way she could come to the US. So with her, she just needed to understand the bigger picture. She needed to be able to connect the dots. Once she started to go through material, it's like literally the light bulb turned on in her brain. And it was so amazing because she actually emailed us and informed us that she took her NCLEX exam in only 35 minutes. That's half an hour. That's how long it took her to take the test, and she passed with the minimum number of questions. She said, I did it, Nurse Choma. I passed the NCLEX exam. I just received a notification from Oregon Board of Nursing, and now I'm a licensed nurse in Oregon. Thank you so much for your help. Praise be to God. Right? So this just shows you that it's like sometimes you just need to be exposed to the right material repeatedly until you get that breakthrough moment, and then it makes sense, right? So here are some of the changes. So if you have been at nursing school for a while, here are the top, and you haven't, or let's say you haven't taken the NCLEX recently. Here are some of the top three changes when it comes to the exam. Okay. So the first thing, number one, I'm sure by now you know that the test is case study like. Not all the questions. So you still have questions that are SATA questions, priority questions, but now you also have questions that are case study questions, right? So like this one on the screen. You have more critical thinking, analyzing of various information, and less input within the answers. So meaning that you're getting more information and less um, it's not really it's harder, it's a little bit more challenging if you don't know where to focus on. So you have to be able to think more critically. Like with the question I did at the very beginning, that for a lot of students that question is very hard. So that's why I did that one. So you can see how to break it down. And then also increase judgment skills and intervention, right? So you have to have increased ability to judge what's relevant, what's not, what should be done, what interventions are appropriate, and etc. So this change is on both the RN and the LPN exam, okay? Both the RN and the LPN exam, okay? So those are the top three changes with the next gen. So this is why I tell people, if it's been 3 months, 6 months, a year since you've taken the test, don't take too long, but also don't rush yourself. Because unless you're somebody that has high stamina, high motivation, um, I don't encourage rushing to take it, because I know, because most people are not like that, unfortunately. You know, most people, what happens is that they take the NCLEX one time, they, take it, 45 days, or I just got my ATT, take it, and they take it as soon as possible, don't pass it, and it just like totally wipes their self-esteem. It makes them feel so sad, so discouraged, and they just don't go back at it again for like years. So if you know that's you, then don't rush to take it. Give yourself adequate time to study and then take the test. So what we covered so far, we talked about how to better understand the diseases. We went over common mistakes that most test takers are making, the biggest myth about the exam and why it's not true. And then we also talked about how to effectively break down NCLEX questions. Okay, so if you want our help, if you found this information helpful, let us know. And if you want to learn more, right, you want to continue to implement this type of strategies, we have multiple more strategies, 20 plus more strategies, rationales, breakdown, helping you also to get more visual aids, more practice questions. We have those resources that will help you to constantly see that bigger picture, help you with pathophysiology. How much do you think it would benefit you if you're able to go through multiple teachings that showed you, okay, here's the path of COPD, here's the path of heart failure, and etc., right? And then now it clicks, you take the test, and you finally pass your exam. So what we can offer you today is our Choosing Nursing Plus membership. This is literally a huge opportunity because it's an all-in-one membership where you're getting everything that you need to not only pass your exam, but to excel in your nursing career and beyond. So with Choose Nursing Plus, you're receiving everything you absolutely need to be successful, all in one opportunity. So here's what the program looks like when you get access to it. This is one of the modules. That's actually one of the sections. So the program includes NCLEX mastery teachings, where it provides a study plan, of course, objectives, pre-test, post-test, multiple assessments, and multiple video modules as well. And then there's also questions for RN, LPN, and etc. We also have audio lessons, video lessons that goes over things like fluid electrolytes, cardiac problems. We also have easy reading downloads, PDFs for you to enjoy as well. And like I mentioned, it includes practice questions. And with each of the practice questions, you also have an answer key that you can access to. You'll be able to immediately see where you stand, your percentages, and you'll be able to track your learning. So with the Choose Nursing Plus, it includes over 700 comprehensive practice questions. The questions are detailed answers, rationales. It covers multiple nursing topics. You're able to practice and apply nursing knowledge. There's many opportunities to help you to identify your knowledge gaps and exposure to NCLEX style decision making, so you can think more critically. And there's over 100 hours of video modules as well, right, to help you to really improve as well. We go over everything, like all different topics, everything from how to master pharmacology, because that's the area for a lot of people struggle with, all the way to OB, to EKGs, every topic you can think of that's on the test, it's definitely covered within this program. It also includes a cheat sheet library as well. So with the cheat sheet library, with this one, you'll be able to access and download different type of cheat sheets that you can use to start studying with as well. So we've had multiple testimonials over the years. We've also changed the program's name a few times, so that's why it doesn't have the same name on here. But this person mentions how she wants to say that I want to say thank you to Choosing Nursing for helping me to prepare the NCLEX. The program was the key that she needed to pass the NCLEX. She was a nursing graduate out of school for 13 years, and she was able to finally pass it. So she very much recommends the program. Another thing too, all students that join the membership as well, if you're an annual member, you'll get free access to attend any of our live review classes that's coming up. So we do have a 5-hour live review class where we're going to be teaching you like the type of training I just did right now, and I just showed you right now. It will be similar to that, but for 5 hours, along with also core teachings like pharmacology, prioritization, and delegation, going over practice questions, and you'll also get access to the recording and the PowerPoint slides. So people that join the program that are annual members immediately get free attendance to these classes, but all other members, which I'll go over in a minute what that looks like, all other members are able to receive a 40% discount off of the class. So even if you decide not to join as an annual member, you'll still be able to get a special discount from the classes. And then as well, the main thing you're going to gain is that you're going to learn that the content you need to know in a way that's simple, easy to understand, and convenient. You'll understand multiple strategies to help answering these questions so your confidence level can dramatically increase and boost. And you'll have everything you need to successfully prepare for the test in one program so you no longer feel overwhelmed with how to really study for the test. So with this one, like I said, you're getting multiple things in literally one membership. So the last thing too is as far as what does the cost look like. So we made this extremely affordable, but it's only for a limited time as far as like the discounted rate that we made it for, because we want as many people to be able to get access to it and be able to utilize it so that way they can pass the nursing exams or do anything else that they need to do when it comes to their nursing career. So for this program, we previously had it at the rate where to get started, it's only you can do a monthly plan. And recently, the rate was monthly plan was $24.99. So that means that you sign up for on a month by month basis. Quarterly, $59.99, $60, or annual rate of $219 annually. But we want to offer something extra special right now to lock people in, or people that want to join, where if you join now, you can join at a special founding member rate. So the first 500 people that join, we're offering them a special discount before we raise the price back up. So instead of it being that price, the prices are lowered where it's now $14.99 monthly, $39.99 quarterly, or $149 annually. All right. So if you want to join right now and you can afford to join at $40, $40 means that you literally get access to the entire membership, and you'll have access to it for 3 months unless you decide to renew for another plan. Right. So literally you can get started today and get access to everything for just $40. So with this one, you can join. Most people usually do the quarterly option, but it's up to you if you feel whatever your budget looks like. You can also do the monthly price, which is currently $14.99 a month, quarterly $39.99 a month, or annually, which is $149 per month. So what I will do, I'll go ahead and post the link for all the plans in the chat box. And then if you have any questions, I'll stop the recording in a minute and answer any questions you may have. Okay, so just give me a second so I can pull up all the links and post it for you guys. And then, like I said, if you once you register today, you'll get immediate access to everything, the entire program, the modules. Nothing will be restricted. You'll have access to all of it right now. And then, in addition to that, you can also be able to, depending on which plan you join, you can also join and get a special rate if you want to be able to attend our next 5-hour class, which is actually coming up very soon. Our next class is going to be held as early as next week. Okay. So if you want to register, like I said, I posted the link in the chat box. We'll also send it out via email if you want to register via email. Here's some more testimonials. This is Tiffany. She said that maybe the program made her feel more confident in her content. It helped my anxiety level to go down because the study plan was explained where it was easy to understand. So the program does include a study plan along with also a plan to help you to tailor based on your background. So for example, if you've been out of school for X number of years or you just graduated from nursing school, we actually have a special calculator to help you to identify when you should take your test. She shared how it's easy to understand. It does also include audios as well. So I've added audios where I'm breaking down questions. So it says it was easy where the audios were not too long, where I lost interest in the middle of the audio. And she passed the program. She passed on her third try with the program. So this is everything you're receiving. So what's amazing about the membership is that it's not only just an NCLEX review program. It actually includes more materials beyond this. So if you are right now watching this and you're a nursing student or you are thinking about pursuing nursing, right? Or you just graduated, you're not ready for the NCLEX, but you want to have access to this information. That's what's amazing is that you're actually getting way more than that. So there's like a question bank that's included with the rationales, 100 plus hours of video lessons, test taking strategies, a full NCLEX review library, but we also included other materials for other students, such as anatomy physiology, TEAS exam, EKG interpretation training for those that are trying to become monitor techs, lab values review. We also included CNA prep review. And then there's additional webinar trainings included. There's actually a 5-hour module where I just pretty much go over priority questions and just pretty much show you how to answer priority questions, because priority questions is 20% of both the RN and LPN exam. And then we also included as well a nurse community. So if you feel very alone right now in this whole journey of becoming a nurse, like you feel isolated, which a lot of people do, we also included a community in the program where you can connect with other individuals like yourself. And then, like I said, finally, the last that I mentioned too is that all annual members will have free access to all and any of our live review classes if you join at the annual rate. If you choose not to join the annual rate, which is fine, you join at any of the other prices, monthly or quarterly, then you'll get a 40% discount off of all of our live review classes whenever you choose to utilize them. Okay, so that's everything that's included in this membership. Once again, if you're ready to take a part of this, you can go to the links I post in the chat to register, or you can also visit our website too. If the link is not coming up in the chat, you can also visit our website, choosingnursing.net, choosingnursing.net. That's where you can also register as well for all 3 plans. Or like I said, I post the direct links in the chat. Okay, so I'm going to go ahead now and stop the recording. And then if you have any questions, you can let me know in the comments, in the chat. And like I said, I hope that you enjoyed this training. And thank you so much once again for tuning in. So let me go and turn off the recording.